Unlocking Your World of Creativity with best-selling author and brand innovator, Mark Stinson. Mark introduces you to some of the world's leading creative talent, from publishing, film, music, restaurants, medical research, and more. You'll discover how to tap into your most original thinking, how to organize your ideas, and most of all, how to make the connections and create the opportunities to launch your creative work. Unlocking Your World of Creativity.
Welcome back, everybody, to Unlocking Your World of Creativity, the podcast where we explore where you get inspired, how you organize your ideas, and most of all, how you gain the confidence and the connections to get your work up and out into the world. And a perfect example of that is the kind of medical research innovations that are going on right now, how to find them, how to build them, how to create companies around them. And we're talking today with somebody who's got experience in all of that, Matt Mitcho in Research Triangle. Welcome to the program.
Thanks, Mark. Thanks for having me. I appreciate you allowing me to share our story.
Absolutely.
Yeah, I will tell you, it's a pretty cool place to live. So, between the three universities right here in our backyard and it being a state capital, the infrastructure that we have, and then all of the ancillary sort of support networks that have popped up around all of that infrastructure. I don't know if I could ever leave here. It's spectacular.
Yeah. Matt is the CEO of a fantastic company called Gemelli. And I want to hear, Matt, about, I guess, all three aspects of what I'm thinking about here, the actual creativity behind the innovation and the medical product that has been developed, and how then that formed a company and how you've creatively developed a model to build that company, and then your own creative process and hiring and building out the team. And
that's great. I'm glad to share. There's a lot there to unpack. So
yeah, we start with the product itself.
So we have two tests now. One is a blood test called IBS Smart that allows us to identify two antibodies that are elevated in someone that had a previous post-infectious event or a previous event of food poisoning that has led to irritable bowel syndrome with diarrhea. We collect a blood sample from a patient with a physician's order and then report back those results of the two levels of antibodies. And if those antibodies are elevated, as I mentioned, it's really causal to someone having food poisoning or a post-infectious event in the past that has led to their condition. So what we're trying to accomplish with that is to allow a patient to get to a diagnosis more quickly so that they can get to either a therapeutic or dietary resolution more quickly and help them feel better. The second test that we have is called Trio Smart, and it's a breath test for identifying gases that are associated with small intestinal bacterial overgrowth. So this is an established market and there's one competitor on the market, but essentially what we're doing is measuring three gases instead of the two that they measure. We have also built a proprietary collection system and instruments to measure the gas levels that we believe are an advancement from where the market has been in the past. So again, goal is to get a patient an answer more quickly that allows them to either make a dietary or therapeutic change to help them feel better, which is the end goal.
Mm-hmm. And I guess the relationship that you have with the actual researchers that found, identified, developed these tests, I think just the collaboration is an interesting one to look at too.
Absolutely. So though I am in Raleigh, our great friends on the West Coast at Cedars-Sinai in Los Angeles have really developed these assets and, allowed our company to commercialize them. So we have, exclusive licensing agreement with Cedars in order to bring these two assets to market. And specifically, the folks that have been involved in developing these assets are Dr. Mark Pimentel with the MAST program, Medically Associated Science and Technology program at Cedars, Dr. Ruchi Mathur, who's an endocrinologist and just an all-around amazing human, Dr. Ali Rezai, who, like Mark, is a gastroenterologist. The other scientific founder who is a gastroenterologist is named Kapil Gupta. The four of them and myself are the founders of Gemelli. Four of them are MDs, and obviously I am not, but I am grateful for their partnership and friendship. It's really incredible what they've accomplished.
And I think a lot of people, sort of on the outside looking in, don't really appreciate sometimes the combination of the science thinking, the real bench research, and the commercialization mindset that it takes. It's like, well, we'll invent something and everybody will clamor to it and then we'll change the world. There's a few steps in between, isn't there?
There are. I think that's actually how we met years ago.
Uh-huh.
You were working with an advertising agency when I was working on another of Dr. Pimentel's inventions, Xifaxan, which he developed the use of for irritable bowel syndrome. It's a non-systemic antibiotic that a company, Salix Pharmaceuticals, that I used to work at, had, and then we were acquired prior to coming to do this. So, but that process is quite interesting, right? So you have technology that can help people, but then you have to actually like connect it to the people. And what we do is figure out the position in the market, that kind of where it fits within the competitive set or the baseline of where the market is. And then messaging around that positioning that allows either physicians to understand where it fits into their diagnostic or therapeutic protocol, or if you go direct to patient, for a patient to understand why this test could be important for them to get an answer that allows them to eventually feel better. So that's what I have done for a living, is figure out the right words matter to, articulate in order for the end user or the customer to really kind of connect with whatever asset it is that we have responsibility for.
And I must say, the name of the company, Gemelli Biotech. And honestly, Matt, I've known you, I've known the company, but until today, I did not look up the meaning of the company name. And here we are talking about bringing the science to the patients and the people. And you've built it right into the name, haven't you? Tell us about that.
Sure. You should have known better, Mark.
I should have.
You have
Why didn't
an
look under
Italian
the hood?
Catholic guy from Philadelphia, naming a company an Italian name. But actually, I'll have to give Dr. Mathor, Dr. Ruchi Mathor, the credit for coming up with the name. She has twins who are now, out of college. But when we came up with this, we thought that, the goal of having a company that means twins in Italian is to, by doing well, you can do good. Now, we are 3 years into this, and I believe we are doing well and helping a lot of people. But, the assets are, let's focus on the post-infectious situation. So, if we are able to have a successful company, it will allow us to have the resources to connect with people across the globe and to help them feel better. If you look at a lot of these kids in Africa that look malnourished or look like they, are distended, et cetera, my understanding from working with Mark and Ruchi is that a lot of these kids are really just suffering from multiple events of food poisoning and a post-infectious condition. Could you imagine if we take these commercial assets due to some success in the marketplace and are able to bring them to folks that could benefit from having a better understanding of what their problem is, so that folks in the community can help them get better more quickly? I think that's the end goal. So yes, it's a fun name. It is not a macaroni-based name, as some people like to say. There is a pasta called
There's no
Gemelli.
pasta.
No, it's really, the dual purpose of what we're trying to accomplish.
Yeah. I recently talked to an author who really underscored what you said about doing well and doing good. Her phrase was altruistic capitalist, which I thought was a nice combination. But the fact that you've tried to build the business with this mindset, tell us just a little bit about the model of how you've set up the company and how you want to go forward with it.
Years ago, I went to business school at Chapel Hill, and very grateful for that opportunity. And it's been a great relationship for me personally throughout the years. And one of the things I remember reading there was culture trumps strategy. And, you can argue that all day long, because you obviously still need a great strategy, and the execution of the strategy is even more important, some would say. But the culture that we've established is what I'm most proud of. So, okay, the dual purpose of the company leads to culture. The culture leads to us being able to recruit great people first that happen to be talented at what we do for a living, and then to build off of that. We're up to 12 people, and only one person has moved on in the 3 years, and it wasn't a bad situation, right? So we've been very fortunate to find great people that are really good at what they do for a living.
And you didn't go to the same cookie cutter job description and
I knew you were going to ask me
hiring
this.
profile. You've got to tell us about that. I mean,
So,
it's part of that culture that you're describing.
Yeah, no, it's true. And it's a little bit of, I guess you could say, self-hate, right? So I grew up as a sales rep, sales training person, marketing professional in pharma. And there are a lot of us. Now, Gemelli has one of us, and that's me. And it's okay. That's plenty. What we have tried to do is look for consumer packaged goods folks, people with diversity of experience, diversity of backgrounds, diversity of thinking. The game that we play is really an operational game. If we can do something that's on the market, but do it more effectively, more efficiently, with less error, that's the end goal. Our job is to report results to patients, and those results need to be perfect in order for the patient to understand what's going on in their own body, in order for them to go feel better. So the recruiting of personnel, and our head of marketing and operations, he went to film school at NYU. I mean, that's not your normal person that works in pharma and diagnostics, and it's working for us because we believe in diversity of experience.
And I enjoyed reading some of the bios of those team members. And one of them comes from the hospitality industry. And I thought, again, perfect. You want to serve people. You want to serve the customer, both the doctors and the patients and so forth. And to have that mindset, that mentality, and especially maybe that training, how do you create a process around service?
That's right. That's right. Yeah. The person you're talking about, she's spectacular, and she's a great writer, and the way that her personality comes out in these communications is, really, really who we want to be to the end user. There's another person on the team that I think about on a daily basis, and he runs our customer service group. And, we get emails every day, right? Most of the time you get emails when things don't go well, but we get emails every day about like, whoa, that customer experience that I just had with, X person was spectacular because et cetera, et cetera, et cetera. But it starts with the culture that we've tried to establish. And, we fight to maintain that culture every day. And as we raise money and expand and get bigger, it's going to be harder to maintain. But so far, so good. As long as I think we keep a focus on it, we should be okay.
Mm-hmm. And, talking about these people's background, I wanted to think about you for a second, Matt, and that is, where did this, we're going to do things differently, we're going to break the mold, how far back in your resume do we have to go to find that lesson learned? Was there an event? Was there a mentor? Was there, the educational experiences? Where do you think that came from?
Sure. Yeah. If you ask my parents, it's probably from birth, but no, I've been very fortunate to have a lot of great people in my life. And, I will go back to my parents. So, I never worry about failing because they loved me, they still do. Great wife, great kids. If this fails, which I don't think it will, I still have them. I'm sure somebody would pay me to go do something for a living. So that's kind of how I think about it. Now, don't get me wrong. I stay up all night, every night, thinking about the business and cash flow and this, that, and the other thing. But I think that broader, more macro mentality, there are a handful of people. And then I'll tell you a funny story kind of over the last year and a half that's really, I think, transformed the company. But there are people like Dr. Jerry Bell at UNC, Dr. Lewis Sheets at NC State, Dr. Raymond at Clemson University, she's a marketing professor that my wife had at Clemson, and she's taking a liking to kind of what we're building here, and I'm very grateful for that relationship. Even Mark and Ruchi, the co-founders, Ali Rezai, have been beyond supportive of what we're doing, kind of with their babies that they've developed and we're bringing to market. But I'll take a step back to Dr. Jerry Bell, and if you look him up, he's kind of world-renowned coach, teacher, et cetera. And when COVID hit, he called me, and I didn't really think so much about Jerry Bell thinking about me ever, right? But he did. He called and said, "Hey, what are you doing differently with this business? How are you pivoting? Because you need to." And I was like, "Well, I'm thinking about that right now, but I honestly don't know what to do." And he said, "Well, you have the one product on the market. Do you have anything in development?" And I said, "Yes." He's like, "Is it close?" And I said, "Ish, but we could probably, move quicker on that second asset." And the second asset has turned into a juggernaut. So we're able to escalate development or scale more quickly. It is a true mail-in test. So it does not require a patient to go into a doctor's office. It can all be done remotely. And we never skipped a beat. So by getting that product to market more quickly during COVID, it allowed us to win and be where we are today. So I'm very grateful for, it's the butterfly effect, right? He picked up the phone, he called me, we had a conversation, we thought things through, and now the entire company and prospects of the company are in a much different place than if I was just kind of on an island thinking about it myself. I guess that gets to the mentorship a little bit, but I think unapologetically sharing your story leads to people caring about what you're doing as long as you have good intent.
I think so too. Well, let's continue that butterfly effect, that ripple effect. What do you think takeaways for other people who might be listening? They've been, look, COVID or no COVID, somebody's sitting on something. What would be your insight and your experience on, yeah, we got to get it right, but sooner or later we got to launch?
Yeah, you have to trust yourself. So trust yourself, trust your gut. So if you're sitting on this thing and you're like, well, is there a market for it? Is it protectable? Is there IP? Is there this? Right? So I knew that these assets were really good. That's why I took the leap. I could have stayed in a very simple, totally, fine for other people, but I needed to challenge myself personally, career, and I chose not to. Now, we'll see whether or not that was the right decision. The jury's out, but for me personally, the journey of the last 3 years have been, I would say professional defining, life defining in many ways. And I would have always regretted not giving it a shot. I guess to answer your question specifically, if somebody's sitting on an idea, do the work, see whether or not there is a path forward. If there's a path forward, do it. You'll never regret trying. If there's no path forward, be honest with yourself. Say, hey, you know what? Maybe that thing's not as good as I think it is. Because it really doesn't matter what you think it is. It matters what the market thinks it is.
Fantastic. Well, we have to look towards the future. Certainly, we've been looking for brighter and more optimistic times ahead for all of us, but specifically for you, Matt, and your business. What do you see over the horizon?
Sure, expansion. So we're working with a variety of partners right now to scale the business. We think that we have two really special assets, and there are other things that I think we could bring into the business. But for now, we really want to stay focused on our core competency, which is, mail-in testing for these two assets, and get it out to a lot of folks that could benefit from it, both in the US and internationally. I think by doing that and being patient in doing it the right way, will benefit from the rewards of what we've built later. But focusing on the day-to-day, making sure the culture's right, making sure that the end user is benefiting from our assets and hopefully feeling better based on getting an answer. We focus on those things, everything will be fine.
Terrific. Well, on this show, we talk a lot about collaborators and cooperation and partners, and I can't help but think about what you're building there. What do you need? You say somebody out there is looking to team up with somebody like you. What are you looking for?
That's funny. So I was listening to a few of your other podcasts, and you always at the end ask everyone sort of who's your customer? What do you want out of this? And I think I said it earlier, just sort of in the normal course of the conversation, but I am unapologetically sharing our story every opportunity I can. And whether or not that means that it's a business relationship that comes out of it, that's fine. Reach out to us. It's great. Glad to take a first call. More importantly, if there are people listening to this that have been suffering from GI conditions for a long time, maybe we play a small role in helping them feel better and getting more out of their life on a daily basis. So, whether or not it's calls that I take with finance folks or personal conversations, when folks understand kind of what we do for a living, there's always a personal connection. It's always, hey, my mom, hey, my wife, hey, my husband, hey, my this person could really benefit from kind of what you guys are doing. I mean, this is a condition, either IBS or SIBO, that affects somewhere between 30 and 45 million people just in the US alone. So you're not alone. It's okay. Diarrhea and constipation are not that big of a deal of something to talk about. Raise your hand. There's help out there, and we hope to be a little part of that.
That's very encouraging. Well, Matt Mitcho has been my guest. He's the CEO of Gemelli Biotech and a good friend, a longtime industry colleague, and great catching up with you, Matt.
I'm very grateful and always love talking to you. And I'm excited to, kind of continue to stay in touch. And you never know, maybe we'll work together again someday.
Well, and that's the great thing. And again, everybody's looking for silver linings around COVID and coronaviruses and quarantines, but the ability to stay connected. I mean, how many
it's
people
great.
do you think right now, just like the professor you just talked about, pick up the phone and give somebody a call? I think that's another lesson I take away from many of the conversations like the one we've had today.
That's exactly right.
You want to make a connection? They're one phone call, one Zoom, one link away, right?
That's exactly right. And I think that's part of making connections is don't make a connection to see what you can get out of something. Make a connection just to be there for someone else. People can see through selfishness. So you know what? Make a connection to be a giver, not a receiver, and things will work out.
Great insight. Great advice. Well, thanks, Matt, for being on the program. And
Take
thanks,
care.
listeners, for coming by. We're going to continue our around the world journey to talk to creative practitioners, including creative business practitioners. I think a lot of times people have asked me the kind of authors and writers and songwriters and such that we have on this show, but listen to the creativity of the business model of a lot of the people we talk to as well. There's a lot of lessons to be learned there. So we've gone to Raleigh-Durham today. We'll continue our around the world journeys to talk to creative people about how they get inspired and how they organize their ideas, and most of all, how they gain the confidence and the connections to launch their work out into the world. So come back again next time. I'm Mark Stinson, and we'll be unlocking your world of creativity. Take care.
Unlocking Your World of Creativity with best-selling author and brand innovator Mark Stinson. This program was produced by BSB Media, creators of IntelliKey Leadership Stories, Unlocking Your World of Creativity, and thepeaceroom.love. We've created a special offer just for listeners of the podcast. You can get the book, A World of Creativity, for a special price of $5.98 for paperback, and the Kindle version is only 99 cents. Go to mark-stinson.com to take advantage of this special offer. Our podcast is supported by Adobe and the Adobe Creative Cloud, the world's best creative app and services, so you can make almost anything you can imagine wherever you're inspired. We use Adobe to help make this podcast, using Audition, Premiere Rush, InDesign, and more. So join the creative community with the Adobe Creative Cloud, and let's make something better, unlocking your world of creativity.